barrier. So it is difficult for any microorganism to reach the meninges that easily. Okay, but still, if they have the meninges or the CNS, the central nervous system, the brain parenchyma, or the CSF or the meninges, they can get infected by different means. They could be like the cells themselves can be directly infected, or they can the microorganisms can passively get transported across the intracellular vacuoles, or they can hitchhike along with the WBCs. Like mostly in case of HIV, you will see that, like the Trojan horse, if you have heard that story, the army, they hide inside a wooden horse, which is known as the Trojan horse, and reach the enemy country. Similarly, the HIV virus, they hide inside the WBCs and reach the CNS. Okay, so some of the organisms, the viruses, can get into the CNS hiding inside the WBCs, or in some cases they can move along the nerves, the peripheral nerves, and reach the central nervous system. For example, in case of varicella zoster virus, or in case of herpes simplex virus, or in case of rabies. Okay, so in rabies, you will see that the virus, they never enter the bloodstream. They travel along the sheets of the peripheral nerves, and then they finally reach the central nervous system. So these are the ways how the viruses can reach the CNS to infect the cells or the membranes around the brain parenchyma. What are the host responses? Generally, what you see if there is an infection of the CNS is that you will see a raised cell count in the CSF. If you do a CSF analysis, the cytology will show the cells which have increased in number. The cells can be different, like in case of acute bacterial infection, you must have read that the predominant cells which the count of which are increased is the neutrophils, whereas in case of chronic, you will find mostly the lymphocytes. In case of viral meningitis, initially you'll see the neutrophils as raised, but within 2 to 3 days, it will be taken over by the lymphocytes. So in the very beginning few days, it'll be difficult to differentiate just by the cytology whether it is because of the bacterial cause or because of the viral causes. Okay. Then in the viruses will then spread from cell to cell, and in case of virus, whereas in case of bacteria, because of the inflammatory response of the host, the infection is restricted to one place. Okay, so usually in case of bacteria and protozoa, you will not see a generalized parenchymal infection. They are limited. Whereas in case of virus, you will see more of encephalitis. The entire brain parenchyma is infected. Now, to define, you already know what is meningitis. Okay, so the meningitis is nothing but the itis is inflammation. Inflammation of the meninges associated with an abnormal number of cells in the CSF. Now, what is viral meningitis or aseptic meningitis? The same thing, but there is no growth on routine bacterial culture. That's why it is called aseptic. A without, septic is the organisms, bacteria. So aseptic meningitis is a syndrome characterized by acute onset of meningeal symptoms and fever with pleocytosis, changes in the cell count of CSF, and no growth on routine bacterial culture. Okay, so meningeal symptoms like the stiffness of the neck, or you have irritations because of the irritation of the meninges, you might have diplopia, or some other signs which can be elicited. Okay, so this is the definition of aseptic meningitis. Then we go on to the causes. Okay, although it's not a very important cause of meningitis, viral meningitis is the most common type of meningitis. Although for you guys also, it's the bacterial meningitis is more important to know, but still, viral meningitis, they occur more commonly than bacterial meningitis. I said it's not very important because the viral meningitis can resolve on its own. Okay, and the signs and symptoms are also milder than those of the bacterial meningitis. So you'll see those meningeal irritation, the signs and symptoms of meningeal irritation like headache, fever, photophobia, but there will be less of the neck stiffness or the rigidity. Okay, earlier before the MMR vaccination, MMR stands for measles, mumps, and rubella vaccination. Rubella used to be the most common cause of, not rubella, mumps used to be the most common cause of meningitis, viral meningitis. Okay, mumps, which causes parotitis, the inflammation of the salivary glands. Okay, but after the MMR vaccination, another group of viruses have taken over as the primary cause of viral infection, viral meningitis, and those are the enteroviruses. You must have read about enteroviruses when we dealt with the viral skin infections. Okay, and enteroviruses also are responsible for few of the GI tract infections. So enteroviruses nowadays is the most common cause of viral meningitis in children. Now the next is the causes of viral meningitis in all age groups, irrespective of the age. Enterovirus is the leading cause, followed by the herpes simplex virus, then the varicella zoster virus, which causes chickenpox. Then we have the human immunodeficiency virus, and finally the Epstein-Barr virus. This is in all the age groups. So the first one is enteroviruses. HIV is also common because of the recent, not so recent, but because of the pandemic of the HIV. Then we have, depending on the population, whether the population is vaccinated or unvaccinated or incompletely vaccinated, mumps can still be the common cause of meningitis in such a population where the population is not vaccinated or incompletely vaccinated against mumps. And in case of immunocompromised, like those people who have organ transplant, and they are receiving some immunosuppressive drugs, or those people who are under chemotherapy, or those people who are HIV AIDS, okay, who have HIV AIDS, all these, they may be the predominant virus that can cause meningitis in this group is the cytomegalovirus or the CMV. Then it's also important to know the travel history, because certain viruses, they are restricted to one particular geographic location. Like, for example, in the Americas, in the Africa, West Asia, Australia, and mainland Europe, you'll find West Nile virus, which is a common cause of encephalitis as well as meningitis. Okay. Then in the US, you may find St. Louis encephalitis virus as one of the causes of meningitis as well. So you have to take the history of travel. Tick-borne encephalitis viruses also are there. Then if you have history of contact with rodent droppings or urine, then you may, the cause could be lymphocytic choriomeningitis virus. Now we'll go one by one about the important viruses that can cause the viral meningitis. The first is the enteroviruses, because these are the ones which are the most common cause of viral meningitis, right? So there are many viruses belonging to the enteroviruses, and of which the most common is the Coxsackie B and ecovirus, which are the most common causes of meningitis. Also, you may get Coxsackie A7, A9, enterovirus 71, poliomyelitis virus, all the three types. Even these can cause meningitis. And the most predisposing age group is the infants and the young children. Usually they occur in the warmer climates. So in the temperate areas, they have the seasonal propensity. that is highest that occur in the summer and in autumn, whereas in the tropics it can occur all the year round. As you've already read, the enteroviruses, they have skin manifestation. The infections can also cause skin and mucocutaneous manifestations. So meningitis may accompany the mucocutaneous manifestations. How do we diagnose? We can diagnose by taking the sample. The CSF will be the primary sample. We can also isolate the virus from throat swabs or from the stool. The best diagnostic modality is the PCR from CSF to detect the viral RNA. You can also grow the enteroviruses in human or monkey cell lines. And for Coxsackie viruses, you can use suckling mice to inoculate the mice and look for the signs and symptoms of infection by the virus. There is no specific antiviral treatment that can be given for enteroviruses. The second common viruses that cause meningitis is the herpes simplex virus, both types 1 and 2. Meningitis by herpes simplex virus is self-limiting, as it is true with other viruses also. But if it causes encephalitis, then it is life-threatening and requires extensive antiviral treatment. If it causes encephalitis, encephalitis is the entire parenchyma, the brain parenchyma is also infected. Okay, so meningitis, although it is self-limited, if it causes infection of the brain parenchyma and there is inflammation of the brain parenchyma, it can be life-threatening. So usually the herpes simplex virus, it causes genital infection. So meningitis may be a complication of the primary genital infection. Usually occurs in the sexually active age group, the adolescents and adults. HSV2 meningitis, it has the propensity to recur. Okay, we have seen, as in when we read about the varicella zoster, when we read about the herpes simplex virus in the reproductive, the external genitalia infection, that the herpes viridae, the group of herpes viridae, the viruses, they have the property of recurrence. Okay, they remain dormant and then again reactivate to cause a recurrent infection. So similarly, so HSV2 meningitis, almost 20 to 50% of the cases can recur, especially in women with primary genital infection. So it can cause recurrent benign lymphocytic meningitis. You can culture the virus from the CSF in primary infection, but in recurrent infections, the viruses may not be cultured from CSF. So what you can do is the polymerase chain reaction for the detection of the DNA of the virus from CSF. Then we come to varicella zoster virus, another herpes viridae group of virus. It's a rare complication. The meningitis is a rare complication of primary infection of varicella zoster virus. Primarily, the varicella zoster virus causes infection of the respiratory tract and the skin lesions appear. And most commonly, the meningitis is due to the recurrence again. So you can expect the meningitis in herpes zoster rather than the primary infection, that is varicella zoster. Okay, so zoster, it usually occurs in the elderly when there is an immunocompromised state, when there is stress. So the recurrence of varicella zoster or reactivation of the varicella zoster from the dorsal root ganglia to the periphery, and during that time, it may also cause infection of the meninges. How will you detect? You do the PCR to detect the DNA, and also you can detect the specific antibodies from the CSF. You can also culture the virus. Moving on to HIV. HIV primarily, it can cause the meningitis by its own. The virus itself can cause meningitis. Okay, so in primary HIV infection, you may get in up to 17% of the cases during the time of seroconversion, you'll get the signs and symptoms of meningitis. If such a case occurs in primary HIV infection, then they have a faster disease progression. And if somebody comes with those signs and symptoms with a history which is suggestive of HIV, you should look for the seroconversion. You have to test for HIV. In the blood film also, you can see atypical lymphocytes. Usually with HIV meningitis, the cranial nerves are involved. Usually the 5th, 7th, and 8th cranial nerves are involved, and cranial nerve palsy can occur. So again, if someone presents with palsies of these facial nerves, the cranial nerves, you have to again go back and do a HIV serology. Neurological symptoms, they resolve over several weeks. It takes a very long time. And as it occurs in the primary seroconversion stage, you may have to do a serology which may or may not give an antibody positive. In that case, you can look for the antigen, which is P24 antigen, or you can perform the RT-PCR to look for the HIV genome. Culture can also be done, but it is not a very common modality for diagnosis. Then mumps. Mumps, which used to be the first of the causative agents. Nowadays, it has been mumps we don't see that often because of the MMR vaccination, but still you may have an outbreak in pockets where you do not have the MMR vaccination, or there is an incomplete vaccination done. So it used to be 15% cases of mumps used to have meningitis as well before immunization. And it may precede or follow parotitis. Okay. And around 50% of the cases occur without parotitis. The males, they develop meningitis more often than females. Usually in males, the mumps, the symptoms, signs and symptoms of mumps is more severe in males. They may have oophorytis, epididymitis, etc. And these are males are the ones who more often have meningitis as well. How do you diagnose it? You can isolate the virus from the CSF, and you can also demonstrate the rise or fall in the antibodies between acute and convalescent sera. Now, the diagnosis. Generally, how do we diagnose a viral meningitis? You can look for the CRP and the WBC count, but as I said, these are not very helpful in differentiating, okay, because last time in the last class in bacterial meningitis, you must have seen that the CRP is raised and neutrophils are the predominant cells in the CSF which are raised, right? And in acute viral infection, in the initial days, the neutrophils are again the ones which are the predominant cells, and they will be raised. Only later on, after 3 to 4 days, these will be replaced by lymphocytes. So in the early diagnosis, in the initial days, these might not be as useful. Then what do? You can go for the biochemistry of the CSF. You must also have seen that in case of bacterial infection, the blood glucose level goes down because the bacteria uses it up, right? And how do you look for the CSF blood glucose? You have to always compare it with the glucose level in the blood, because if a person is hypoglycemic, if the person's blood glucose level is low, then you'll expect that the CSF blood glucose will also be low. Okay, so you'll have to find out the blood glucose level first along with the CSF level. In any case, in any meningitis case, if you are doing the biochemistry. So in this case, in viral meningitis, you might not see that fall in the blood glucose level. The cytology, the mononuclear pleocytosis may occur. As I said, neutrophils will predominate initially. To test the CSF for you can test the CSF for enteroviruses. Usually what are done if you suspect aseptic meningitis is you look for The most common viruses, those are the enteroviruses, herpes simplex virus, and the varicella zoster virus. If there is, if you're suspecting it to be a zoster, recurrence of varicella zoster, then as I said, if you suspect, if there is a history of HIV in any contact or any predisposing risk factor, then you should also go for the serology of the HIV. You can do the PCR, which is a very sensitive test, and it is almost 3 to 1,000-fold more sensitive than viral culture. So most of the times nowadays we have a multiplex PCR. Multiplex PCR means in a single test you can detect the RNA or DNA of multiple organisms. Okay, so you can do a multiplex PCR in which in one test run will detect the genome of these common organisms, common viruses, enteroviruses, HSV, varicella, HIV. So all these are the usual suspects, and we detect the genome, either RNA, DNA, in a multiplex PCR platform. And I told that the most of the viral meningitis, they are self-limiting. Okay, we don't have a specific antiviral drugs to treat, but identification of viral cause is useful. Why? Because it will decrease the unnecessary use of antibiotics and the hospital stay. You know that the hospital stay itself bears a risk of acquiring hospital associated infections, healthcare associated infections. So it is always better to confirm the diagnosis, whether it is a bacterial cause or a viral cause. So you can avoid the unnecessary use of antibiotics, you can avoid the unnecessary stay in the hospital. So that's the last of the slides. So just to summarize, clinically it is difficult, although the signs and symptoms are a little less severe in case of viral meningitis, but still it is difficult to differentiate clinically the bacterial and viral meningitis. Usually the viral meningitis, although it can occur in all age groups, usually it is more common in the younger ones, especially the enteroviruses that cause infections in the infants and young children. Enteroviruses are the most common cause of viral infection throughout all the age groups. Although most cases are self-limiting, morbidity may be considerable, especially as we saw if it is if the meningitis progresses into encephalitis. Okay, especially in case of the herpes simplex virus. Also with HIV, you have recurrent infections. Herpes simplex virus can cause viral meningitis that may recur. Meningitis is also a feature of HIV seroconversion. So that's why you have to be alert whenever a young adult or whatever who has the history or the predisposing risk factors of for HIV, you have to suspect HIV as the cause of meningitis and go for HIV serological tests. So that's the last of the slides. I think fungal meningitis is being covered again by Dr. Sushila next week or the next class, and the chronic meningitis will also be covered then. So this is a short class, but it's important in the sense that you may sometimes get a question on aseptic meningitis. What do you understand by aseptic meningitis, and listing a few of the viruses. And you should also remember the chart that Sushila ma'am must have shown you, how to differentiate between the viral, bacterial, and fungal and parasitic meningitis. Okay, so that's all that I have to share with you. If you have any queries. Okay, so I'll just download the attendance. Do you have any questions?